Hi everyone, and welcome to our newest installment of Coffee with a Counselor. Today we're going to be meeting with Josh Stein of American Addiction Centers. We're going to be talking about what his agency does and how he can help you and your family. Hi Josh.
Hi Chrissy.
How are you?
Good, how are you?
I'm doing well. So, who are you?
So I am Josh Stein. I'm the treatment consultant with American Addiction Centers, and I take care of Western Pennsylvania. So we have 12 treatment centers across the United States, specializing in medical detox and a residential level of care, which is an average of 30 to 45 days. And we primarily help people struggling with substance abuse or co-occurring disorders. So anxiety, depression, bipolar, PTSD, folks who tend to self-medicate for other circumstances they've been dealt with.
So, how did you get started in this job?
So I actually have kind of a unique situation with a family member who struggled with opiates for 10 years. Thankfully, he's doing very well. But I've also had the experience of seeing the other side of that, which would be a very good friend of mine who unfortunately passed away 3 years ago from a heroin overdose. So a lot of my experience has been from just living it, and I think that's critical. If you haven't been affected by it or know somebody, it's kind of hard to understand exactly what addiction's all about.
So, how does your agency help people when they're in a crisis situation?
So my primary role is to create relationships with a number of different entities within our community. It could be hospitals, crisis centers, private therapists, family support groups. And basically what we do is try to make sure that we're connecting those who need treatment options connected to the right people. That could be an inpatient level of care. It might be an outpatient program, or possibly somebody just needs to talk to someone about, a loss, or a son or a daughter that's affected with addiction. They don't know how to handle those circumstances. So, generally speaking, take the call, understand what the needs are, go through an assessment if necessary, and then we start to make that recommendation on the level of care.
What do you think are the most common issues you're seeing in our community today?
I think there's still a very, unfortunately, a big stigma on addiction, and I think that the education piece is lacking. Family members don't really know signs and symptoms a lot of times, and unfortunately don't know really who to contact to get help. And it's tough to navigate sometimes, because just because you're struggling and go to a hospital does not mean that they're going to admit you and start to take care of you. So there can be confusion and a lot of people who are just upset about the fact that they assume they're going to get what they need and they don't.
It's very frustrating.
Yep.
So, do you have any common signs or symptoms that people should look for in their family members or loved ones if they suspect there's a problem?
Yeah, I mean, some of the most common are, missing work. Heroin is nodding off a lot of times. Legal trouble, things missing from the house, just behaviors that are just out of the ordinary. And, something to take into consideration is maybe a life event that's happened and that person's never really dealt with that or worked through it. And their way of handling it is unfortunately turning to alcohol, opiates, other substances to kind of deal with the pain.
So if somebody does notice these characteristics in their friend or family member, what is the process of contacting you and working with you to get linked up to services?
So I'm available 24/7. My cell phone number is basically on everything that I hand out. Certainly will probably be on this as well. You can contact me at any point and just have a basic discussion. It could be the person who is struggling or a family member that's concerned. And what we would do is just take some basic demographic information, and we have a clinical team that would perform an assessment over the phone. And the purpose of that is to really determine the right level of care. Once that's established, then we can make a recommendation, and we can do that in as quick as usually 90 minutes. So it's a quick turnaround.
So after treatment, what happens with the patients?
In my opinion, I think in a lot of cases, what somebody does after treatment is actually more important than the treatment episode itself. being in a sheltered environment for 30 to 45 days provides a solid foundation, but a lot of the people that are struggling with addiction did not arrive there in 30 days. So there has to be a long-term approach to making sure that one can stay well. We like to make sure that somebody's set up with an IOP program, intensive outpatient. They're seeing a private therapist if there's any kind of behavioral disorder there that needs to be worked through. They're attending meetings. Normally 90 meetings in 90 days is what's recommended. So all of those appointments are set and established before that person actually leaves our doors. And it's really essential to make sure that when they come back into their environment, they're participating in those right levels of care. One of the most critical pieces of addiction is the co-occurring piece.
Mm-hmm.
And it's not only for the individual, but also for family members too. So I'm very thankful for your organization and what you guys do. We had a lot of success with family members that don't understand how to really work with a loved one who's going through that process, or maybe somebody who's lost somebody from addiction, dealing with the grief and the trauma as a result.
Could you talk a little bit about how outpatient therapy plays a role in aftercare?
Absolutely. So a lot of folks will participate in an intensive outpatient or an outpatient program. That's really where they're going to get the tools and the resources that they need, or a continuation of what they learned in inpatient, and that's absolutely critical. But what a lot of people fail to realize is how essential it is to work on the behavioral part of it, because if you're not really getting down to what issue is there and why some of the substance abuse has started, it's likely to come back. So the anxiety, depression, the self-medication piece, there's usually a bigger story as to why that's happened.
Is there anything else that you would want people to know about you, your organization, or addiction treatment?
The most important thing that I would want anybody to know that is struggling with addiction or has a family member or loved one that is struggling is there is hope, without a doubt. There are many, many people that I have worked with over the course of the last 2 years that are clean and sober, that are doing extremely well. And I would just make sure that you get educated, do your best to break the stigma and understand that there's usually something bigger going on in that person's life. Utilize your resources to the best of your ability, and make sure that you're looking at all components of it: the addiction, the mental health, the counseling perspective. All of those are critical to make sure that that person has the best chance of remaining successful.
Mm-hmm. Mm-hmm. So if you or somebody that you love is struggling with addiction of any kind, don't hesitate to reach out for help. There's people like Josh or myself and my agency. We're here to help you. Give us a call. Our number is on the bottom of the screen, and Josh's number is going to be on the bottom of the screen. If you need us at any time, don't hesitate to reach out. Thanks. Have a great one.